Hello, I'm Mike Lindsey, and we are going to talk about some airway maneuvers. Specifically, we're going to talk about how to open someone's airway using just these.
Are those spirit fingers?
No, they're not spirit fingers. They're my hands. Fingers too, but not spirit fingers. No, we're going to talk about how to open up someone's airway using just your hands, your fingers. Anyway, so let's say that you have a unconscious obtunded patient, and that patient, we'll say, is lying on his back, and he is making this kind of noise. And it just seems like he's not really breathing very well. What's actually going on is his airway is relaxed. The muscles in his throat are relaxed, and the tongue is relaxing and going backward. All those together, he's actually occluding his upper airway. So what you need to do is open that upper airway. There's a couple techniques you can use to do this. There's also some other considerations that you need to have. In a patient who is not suspected of having a traumatic injury, the first thing you can do is simply place them in the recovery position. In other words, put them on their side. This prevents the tongue from relaxing and moving back into the airway and occluding it. Additionally, if the patient happens to vomit, they are less likely to aspirate. If you do not suspect that the patient has a cervical spine injury, you can simply do a head tilt chin lift. Essentially, place one hand onto the forehead, the other hand underneath the chin, and lift. This pulls the mandible forward, relieving any obstruction caused by the tongue into the pharynx. Essentially, with the head tilt chin lift, you're trying to put them in what we call the sniffing position, as demonstrated here. Notice that the external auditory canal is anterior to the shoulder. That is a goal, whether you're doing an adult or a pediatric. Try to get this external auditory canal just anterior to the shoulder line. If the patient is suspected of having a cervical spine injury, what you will do is called a jaw thrust. Take 3 fingers, place behind underneath the jaw, and essentially you're going to manually move the jaw forward while taking your thumbs and pulling the jaw down. Basically, you're forcing them to have a little underbite. Now, note that if you try to do this on a patient who's awake, they're generally going to make this sound. Ow, that hurts, please stop that. This is generally a painful thing to do to someone who's awake, but if someone is unconscious, I'm sure they won't mind that you are saving their life by opening up their airway. You can do a combination of the two for a patient not suspected of having a cervical spine injury, and that basically you do a head tilt chin lift with a jaw thrust and pull it down. I hope you enjoyed that demonstration on manual airway techniques of the jaw thrust and the head tilt chin lift. I am going to finish up with some pediatric consideration. Now, pediatrics, as much as I like to pretend they are, they're not actually small adults. They have different proportions, which makes their anatomy a bit different. They have a larger tongue in proportion to their oral cavity. This larger tongue makes it more likely that they could occlude if they were obtunded. Secondly, they have a larger occiput. In other words, they have a larger head. If you have a larger head and you're lying flat, that head is going to get pushed forward into proportion of the rest of the body. A neck inflection in a comatose patient is more likely to cause an occlusion of it. Therefore, to remedy this, you should place a towel under the shoulders if it is necessary. This is only in smaller kids. A larger kid is going to be more like an adult. Here, we're going to add a example of placing the towel under the shoulders to properly align the pharynx with the rest of the body. Note that the external auditory canal should be just anterior to the shoulders. I feel like Vanna White. Val, anyone?